The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Good day to all of you TMD warriors. I'm Tony Urbanek, and this is the next installment of TMD Demystified. Welcome, and I'm hoping you're having a good day, good week, and a good month. Today's topic is very simple and straightforward. I've been asked to go over briefly why or how using the solution that we've come up with, which is extremely successful for treating TMD, will enhance your practice or what it means to you. Why should you do this? Why should you be even interested? Why is this important to you? What can it do for you? And I've been asked that multiple times, multiple ways. So I think this would be a good opportunity to just confront this topic head on and tell you why. There's 6 good reasons, probably more, subtle, maybe more subtle reasons, 6 major reasons that are not so subtle, besides the most important one, and we'll cover that first, that not included in the 6. The most important one is we have the solution for this problem that's been treated surgically inappropriately multiple times, non-surgically inappropriately thousands, millions of times, using things that are harmful in a lot of cases. And that is my opinion, but I can prove it. I mean, I can show you the stats. We have the stats. So I won't go into that. I'm not here to criticize anybody or any method other than to bring out the differences. So why is it important to treat this problem successfully? I mean, we have the successful solution, but why it's important to do that for you, the provider. So the first one is very obvious, is if you treat this successfully and you know how to enlighten or make other practitioners aware who see these symptoms all the time and don't know what to do with them, if you do that appropriately, it will drive in huge numbers of patients who seek this service, solution to their symptoms. What are the symptoms? Headache, earache, jaw pain, neck pain, tinnitus, subjective hearing problems, vertigo, shoulder pain, hand, finger tingling, numbness, and locking. And there are a few others. We'll have to save those for later. Some of them probably would be debatable, but I'm finding not. But the point is, those are the accepted symptoms. And they're misdiagnosed all the time from practitioners all over the country, all over the world. So the number one is that if you need patients, and I do not know of a private practitioner, the dentist private practitioner that doesn't want more patients, this will drive in more patients, for this service. And in my practice over the past few years, we've developed, as I may previously mentioned, 80 to 100 new referrals or referrals that month, 80 to 100 referrals each month for TMD, besides my oral and maxillofacial surgery practice, which continues to be ongoing. We treat those successfully, and the more we treat, the more patients we get. The second is the opportunity to build your practice, because I believe I've mentioned this before, but If you are in the building phase, this is an excellent opportunity to build your practice in that when you get a large number of new patients, especially from medical providers who are aware of your presence in town, whether you're out in the middle of the county or whether you're in a large metropolitan area, your awareness actually has the opportunity to build your practice. But more importantly, and this is what I see on a day-to-day basis, when you solve that patient's problem of their symptoms, whatever they may be, usually most often painful symptoms or dysfunctional symptoms, you walk on water. They are your friend forever. They talk about you all the time. And if you are a general dentist, I see 100% of those people need other general dental services as I treat them, whether they be operative dentistry or periodontal treatment or doing a dental implant. In my case, I don't treat the general dental procedures that a general dentist would, but limit my scope to oral maxillofacial procedures, and intraorally that would be extractions, impactions, and dental implants. And so about 30% of my patients who I treat for TMD also need extractions, impactions, and dental implants. And of course, I provide those services, and they're happy to do that. They bring their kids in, they bring grandma in, they send their uncle in. Now that I have solved this problem for me, the trust is through the roof. And so it's a huge practice builder, especially for the general dentist, because you can provide, if you wish, just about services for 100% of those people that come into you on that line of referral, primarily from the medical community. Great opportunity to build your practice. Number three, the obvious is then it's a significant increase in your bottom line. If you enhance the mechanics of the marketing program that is available to bring this awareness to your medical colleagues who misdiagnose it, misdirect it, and treat them. It doesn't take a long time to treat these patients non-surgically. I pretty much invest 45 minutes on average, start to finish, consultation, impressions, delivery, and the post-delivery checks, protocol, which is at 3 months after delivery, 3 weeks after delivery, 2 months after delivery, 4 months after delivery, and 6 months after delivery. We hardly get anybody out 6 months that comes back. Once you get them out to 4 months, they come back and see you, say, thank you very much. You can't get them back after that, understandably. So they're fixed as far as they're concerned. When they say they're fixed, as far as I'm concerned, is when they admit that they are 85 to 100% of their original symptoms, whatever they may be, are now gone. And that can happen at 3 weeks, it can happen at 9 weeks, it can happen at 4 months. It doesn't go on 4 months, usually. It's usually within 3 to 6 weeks. They'll say 70 to 90% of their symptoms are gone, according to the protocol. But significantly increases your bottom line. This is a cash-only service. We've talked about that before. Being a cash-only service, having it patented, having it FDA cleared and approved, it gives you the opportunity to stand head and shoulders above the competition in your area and provide a service that, frankly, no one else either wants to do or can do appropriately or significantly and easily. Protocol is not difficult. The technology is not difficult once you understand it. You understand what you're doing. Number 4 we touched on, and that is, again, obvious, flows from number 3, which is no dependence on insurance. So in my practice, although I still practice oral and maxillofacial surgery, and I've had to hire an associate general dentist to see actually the majority of the TMD patients because of my responsibilities to teach this to others, and in the business part of this, the CEO part of it, I do still practice oral and maxillofacial surgery in the office, limited to that now. I don't go in the hospital anymore. pulled the trigger on that about 2 years ago. But I limit myself to office oral surgery, and it has making me totally independent off of the insurance. Although on the surgical side, we still accept insurance coverage for our surgical patients. For the non-surgical TMD, it is not covered. We've talked about that in detail, why it's not covered, how that came to be, why that is, why that's the way it's going to continue to be. But it's a blessing for those network providers in our network, and that it gives you a substantial additional sum of income that filters to the bottom line, that you don't care whether you have insurance or not on some of the other cases that you might do, because it's so effective in bringing in profit to your practice. Number 5 is enhance your practice. I touched on that briefly, but to drive it home is it places you head and shoulders in your community and among your competition. It enhances the visibility and the presence of your practice in your community as something special. It doesn't take long, and especially as you promote this and enlighten your medical colleagues. When I say medical colleagues, I mean generally the whole shooting match of PCPs, ENTs, neurologists, nurse practitioners, physician's assistants, all those NPs and PAs that man the hundreds of walk-in clinics that are in any large metropolitan area, and all of those clinics miss the diagnosis and misdirect the diagnosis of headaches, earaches, jaw pain all the time, along with the other symptoms. So it enhances the visibility of your practice and how it is looked at in your community, large or small. And that is important. As a private practitioner, you want to be known, you want to be respected, you want to be known as someone who can actually do the job and solve the problem. And finally, the 6th is almost as important, I think, as the one we mentioned at first, which is actually having the solution to the TMD conundrum. And that is the personal satisfaction that you will get as a provider to actually have solved this problem for patients. That's the most important thing to me at this point. It kind of started out that way. The first time one of these patients jumped out of the chair and said, "Can I give you a hug? I'm so happy." I mean, and after 20 or 30 years of symptoms and seeing 5, 10, 20 doctors, and you give them the solution to their problem, and it goes on long enough where they're certain that it is the solution. It isn't like, going on for 2 days. It's like after 2 months, they still don't have the headaches and the neck pain and the earaches. I've had multiple husbands, come across the room, shake my hand. I want to really thank you. I appreciate it so much. It's just the personal satisfaction of knowing you solved that problem for that patient, and a significant problem for that patient. And I mean significant problem. I can document 2 of my patients over those 3,000 cases that we've taken on over the past 7 or 8 years that told me, one of them we have on videotape very sincerely, that 2 women had came in to me and said, "You are my last hope. I have been contemplating suicide. I can't stand the pain anymore." And I don't think they were dramatizing. I mean, they were sincere. I mean, and a few weeks later, their symptoms were gone. Now, talk about personal satisfaction. Makes me smile. It truly does. And always will. And it'll even make me smile more when I know that there are other practitioners throughout the United States and Canada and maybe the world who take up the challenge and learn what to do, learn what we have to teach, learn how to do it, and have the same results. And those patients will go on and think that you are an extremely gifted doctor, and the personal satisfaction that you will have with that esteem for your patients, I can't be duplicated in any way, shape, or form. So those are the 6 primary benefits to becoming a network provider for the Urbanek device, and join our network of providers that learn how to use this, learn the technology, learn the basic science behind it, and almost as importantly, learn how to promote it and make your colleagues aware that misdiagnose it all the time. And you will have as many patients in your practice as you care to pursue this line of treatment. So that's it for today. That's it for this installment. I, again, always appreciate your attention, your comments, your questions. I'm available at all times. I do ask you to email Naomi at tmjservices.net if you'd like to get in communication with me, set up a call, set up a Zoom, would like to get on my email list. I'd love to communicate with you about any questions, any comments. Even if you want to be negative about something, I'll communicate with you about it. No problem. So thanks for your attention. I always enjoy doing this, and I appreciate you viewing this podcast. I will talk to you again, hopefully in the very near future.